There's an alarming statistic to share. It could be triggering to some, so just wanted to give you fair warning. But many of us, if we haven't gone through it ourselves, we know a loved one, we have a friend who has. Suicide remains the 12th leading cause of death in the U.S., according to the CDC. The National Suicide Prevention Lifeline has played a pivotal role in helping those who are without hope. The network's call volume hitting its highest number of over 2.5 million calls in 2021. Now, tomorrow, the Lifeline's existing 1-800 number will transition to this 3-digit line, 988. It's meant to route distressed callers to local centers first, connecting them to the national crisis line if those local call centers are busy. Joining me right now this morning is Dr. Dan Reidenberg, Executive Director of Suicide Awareness Voices of Education, also known as SAVE. Dr. Reidenberg, thank you so much for being with us.
Thanks for having me.
You know, a lot of people calling into that toll-free number, now 988, but clearly I've spoken to firefighters, EMTs. There's a huge increase in the number of people using the other 3-digit number, 911, for suicide calls, mental health crises, especially among the homeless right now. So how do you get the word out about a number like 988?
Well, there's going to be a massive campaign that's going to start later this month, and it's going to actually continue on the rest of the year and even going into next year to help people understand how to decide which number to call. Really, what we want people to know is if somebody's in imminent crisis, maybe if they have something that they've already done to hurt themselves, or if they have something that could be really lethal, then yes, call 911 right away. But if not, if they're just struggling, they have a thought about hurting themselves, or maybe they're worried about it, or they're just feeling anxiety, then call 988. And we're trying to help the public understand how to differentiate that, because there are many instances where calling 911 isn't the right answer. Calling 988 and getting a trained counselor would actually be more beneficial to them.
Do enough states have local crisis teams in place, especially with the huge number of people calling for a mental health emergency right now?
Well, not right now. This is going to take time. It's going to be a transition. Where we're going to increase the capacity of crisis centers across the country, being able to handle the volume of calls coming in, because there are so many people that are hurting right now and they need to talk to someone. They might not have a psychologist or a counselor to get to. They maybe can't get into a psychiatrist. So calling a number like 988 and having a trained counselor that can listen to them, support them, give them advice is going to be what they're going to need. And so we're going to need volunteers. We're going to need a lot of people to kind of step in and really help out with that. It's going to take time.
There are reports that this hotline is understaffed. To local call centers, to reroute those calls to local call centers, was that a solution to help with the staffing issue?
We do know that backup centers are really important. The current National Suicide Prevention Lifeline has backup centers across the country that take that overflow for calls in states where there is an overwhelming number of calls that come in, or there might be something that's happening in the public eye that's increasing the number of calls. So we do have that in existence already. This new 988 should really amplify that. It should increase the number of centers across the country, not only just in states, but even within the backup system, so that we can cover that capacity. It's not there yet. We need more staffing, and we need more volunteers. They're going to be able to help out with really the overwhelming demand that there is out there right now in the country.
Is there enough funding?
That's another issue right now that it is really problematic. There isn't enough funding at a federal level or even at states. There's only 4 states that have really figured out funding levels to be able to support not only the existing calls that are coming in, but with the projected call numbers that are coming in. So while we have some challenges ahead of us, the staffing issue, the volunteer issue, the capacity issue, the backup center issue, and the funding issue, we do know that in the end, as this transition takes place and as this network grows, it is really going to be beneficial to the public.
Well, hopefully there is more resources of every kind to help with this effort. And hopefully people do reach out to someone, whether it's this call number 988 that we have on your screen here. Again, that number will direct you to the National Suicide Prevention Lifeline. Or if by chance someone doesn't get that number, hopefully they have a coworker, a friend who notices that they are in need. Dr. Reidenberg, thank you so much for being with us. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.